Thanks so much for watching On Call for All Kids. Today we will be talking about speech, language, and feeding problems. We'll get questions answered about the speech milestones your baby and toddler should be hitting, why kids have speech delays or feeding problems, and how parents can help their child learn to speak. I am joined by Therese Montanari. She is the director of the Speech, Language, and Feeding Program at Johns Hopkins All Children's Hospital. Happy to see you, Therese. Thanks for joining us.
Thank you. I'm excited to be here to talk with you.
Let's first just start off with the prevalence of speech, language, and feeding problems that you see. Is it pretty common?
It really is. Average about 8% of children will have a speech, language, or feeding problem.
Let's talk about what do speech pathologists do here at the hospital.
Okay, so we have 60 speech language pathologists, and they provide assessment, evaluations, and therapy here in the hospital and at our 8 outreach locations. So speech language pathologists treat a wide variety of communication disorders. We see children who may not be talking, children who are talking, but other people may not understand their speech. And we also see children who have language and feeding difficulties that are associated with some medical diagnosis. Those could include hearing impairment, autism, cerebral palsy, Down syndrome. So we treat a wide variety of speech and language, and we also treat patients who have feeding issues that may be associated with a wide variety of medical conditions that may be interfering with growth or impacting a child's mealtime.
Now, how can parents help their baby and their child learn to speak?
That's a really good question. Let me first start by saying it starts when a child is an infant. Communication starts with that first smile. So being a good language model, and that is by responding to your baby's cues. So if your baby's smiling and laughing, you need to look back and smile and laugh. When your baby starts to make sounds, you want to do those sounds back to your baby. You want to read to your baby and to your toddler. And a big area for developing language is modeling words. So you can model words while you're playing. You can give choices. Do you want the baby doll or the truck? Do you want a banana or apple? So we want to model words. And then another thing that's often helpful for parents is to add on or expand. So if a child says car, you can say, oh, that's a big car. And so modeling and expanding. And then the 3 words that I want to really get across today is play, play, and play. Children learn so much through play, but especially that's how they learn languages, through play. So playing through everyday activities. That means talking about what you're doing. So where is your doll? So you can work on comprehension. Talk about different words and take advantage of vocabulary in everyday activities. Bath time, meal times, at the grocery store, all of those are language-rich opportunities.
When do babies actually learn to speak? So what are those milestones that we should be kind of looking out for as a parent?
Okay, so birth to 6 months, really babies are starting to smile, look at you, do a little bit of cooing. Then really we start seeing at 6 to 12 months, the child is using different vowels and consonants and they're babbling. Then 12 to 18 months, that's where first words start to emerge. So they may say mama, dad, up, bye. At 2 years of age, we want to see a child have a vocabulary of between 50 and 100 words. And also they're starting to use little short phrases. Go outside, mommy help. And then if a caregiver is noticing that maybe the child, their child is not doing what other children are doing, that's when probably they want to seek out and talk to their physician about their concerns and possibly to ask for a referral for a speech language evaluation.
Now, what causes speech delays to happen?
Very good question. So a speech delay can be correlated with a number of reasons, a few of which include if they have a hearing impairment. If they have any type of neurological or medical issues, such as autism, Down syndrome, cerebral palsy, maybe prematurity, all of those issues can tend to make a child have a speech and language delay. The brain is extremely flexible from birth into 5 years of age. So that is why early identification of speech and language delays is so very important.
Now, Therese, one thing people may not realize is that speech pathologists also help with feeding problems, which you say is actually pretty common.
It is very common. And like you said, I think a lot of people don't realize that a speech pathologist does work with children with feeding. What we like to say is the same muscles a child talks with is the same muscles that the child feeds with. So some red flags that often you may see with feeding issues would be poor intake, weight gain, or growth. You also may see limited acceptance of certain foods, textures, or liquids. You may see some coughing or gagging. So if they're struggling during mealtime, those would be some red flags that you would want to consult with your physician.
Well, Therese, thanks so much for joining us today. I know I learned a lot, and hopefully, all of our parents watching today did as well.
Great. Thank you so much.
And thank you all for watching as well. Don't forget, you can check out our website. It's hopkinsallchildrens.org/newsroom. And there you'll find a lot of other timely topics in pediatric healthcare. We'll see you next week.